Hello everybody, welcome back to Arbor Vitality. Today we are doing the start of the aesthetic medicine lecture or lecture series, and we will start off with lipolysis, one of the most common aesthetic medicine sort of procedures that you will encounter. So what is lipolysis? It is the breakdown of fat stored in your adipocytes into free fatty acids. In aesthetic medicine, it normally refers to treatments intended to reduce localized fat deposits, improve contouring, and treat small resistant fat pockets. For example, if someone is 10% body fat, but they just have a double chin genetically that refuses to go away, lipolysis could be an answer. And then it's used to improve body definition, such as around the abs, and can also improve cellulite appearance. Important to note, it is not a treatment for obesity. The benefit from lipolysis compared to general weight loss is vastly different. They're just contouring procedures essentially meant to put the final touch. So let's go through the basic physiology of an adipocyte. An adipocyte is a fat cell. It has several functions, namely energy storage, endocrine signaling, insulation, cushioning, and cytokine production. Endocrine signaling, fat cells are hormonally active. In other words, they can signal your body to produce more estrogen and reduce the production of testosterone. They're also thermally insulating because fat is an insulator, keeps you warmer. And then cushioning is helpful in cases of trauma, when one would be concerned about that. And then fat cell biology, the adipocytes normally they're enlarged through hypertrophy, which is increasing in size, and hyperplasia, which is increasing in number. Body contouring, such as lipolysis, normally reduces the size, i.e. it's the opposite of hypertrophy. So we get some categories of treatments. The most common is your injectable brands, such as Lipovela, Kybella, and Cabeline. Then you get your energy-based brands and mechanical techniques that we will get into later. So energy-based modalities. You get cryolipolysis, radiofrequency lipolysis, high-intensity ultrasound, laser, and ultrasound cavitation. Mechanical techniques, vacuum massage, lymphatic drainage, endomology, and shockwave therapy. In injectable lipolysis, you get your deoxycholic acid injections, your phosphatidylcholine based injections. My tongue's not working today. Your mesotherapy cocktails, and like we said earlier, example of that is Lipovela, quite common. So, most common ones, injectable lipolysis. Lipovela is an injectable lipolytic or mesotherapy style fat dissolver, as they call it. Exact formulation depends on the manufacturer and region, depending on legalities in those countries. But essentially they contain combinations of PPC, which is our phosphatidylcholine, as well as our deoxycholic acid, sorry. Some of them contain alkane, caffeine, silica, amino acids, vitamins, and botanical extracts. If you are going to make use of these products, make sure you get it from a regulated compounding pharmacy and not just a random website. Formulation of standardization is often poor, creates important issues regarding the quality of evidence in studies, as well as sterility and safety. Two of the most important things, sterility and safety, for these procedures. So how does it work? Your deoxycholic acid is essentially a byproduct of bile acid breakdown. What does bile acid do? Bile acid helps digest things. Therefore, deoxycholic acid helps digest fat, in a sense. It disrupts the cell membranes of adipocytes, which causes cytolysis. The cytolysis, i.e. the cell death of the adipocyte, releases the lipids and everything else inside the cell, which then triggers an inflammatory response, which then gets wiped up by your macrophages, and then you get tissue remodeling. One of the most common side effects of a deoxycholic acid injection is swelling and tenderness, and occasionally can also lead to fibrosis. Then you get phosphatidylcholine, or PPC, which is very, very widely used. Early evidence suggested that it itself dissolves fat, but now most evidence suggests that the deoxycholate actually does most of the heavy lifting. Evidence for PPC shows that it can emulsify lipids, alter cell membrane dynamics, and support lipid transport. The exact way it does that is not known, but essentially it helps the deoxycholate break down fat cells more effectively and clear out the byproducts faster. So where are these places that people more commonly treat? In the face, it's your submental fat, or it's called your double chin, your jowls, which is your cheeks, and then your buccal fullness, which is typically like the more middle to upper part of the cheek. It's not always recommended because of your cranial nerve 7. We do not want to be injecting a treatment like this into a facial nerve. Then in the body, you get your abdomen, typically in people who are already lean, to enhance the popping out of their abs. Used in the flanks, by the bra area, as well as the in and outer thighs, typically the back of the upper arms for a lot of women, as well as lower back fat. So how does it work? First, you need to assess your patient. You need to get the BMI and body composition to see, first of all, is this treatment actually right for them, or should they undergo a weight loss phase first? Assess fat thickness, skin laxity, as well as the expectations. It is important to manage expectations because these are not miracle drugs. They are not going to dramatically change your body contouring. They will just simply enhance what is already there. If you have a history of keloids or scarring, it may be recommended for you to not do this procedure. And then naturally, because it is a needle going into a person, you should assess bleeding risk. Do not do this in pregnancy or in breastfeeding. And take note of any previous procedures they've done and what adverse effects they may have had during those. Contraindications. Active infection, especially around the injection site. Bad juju, don't do that. Do not do it in pregnancy and breastfeeding, like we've said. Do not do it if severe obesity is the primary issue. Like we said, it's not a miracle drug. It is not a GLP. It is just a local treatment. Manage unrealistic expectations. Those with poor skin elasticity typically perform less well, because if your fat is dissolved and your skin is not elastic and stretchy enough to sort of mold back into where that fat was, it's not really going to make a visual difference. Then almost an allergy is not good. So what are the principles of administration? Typical method: is you mark the treatment area out with a grid, you clean it sterilely, and you inject subcutaneously. Avoid muscle and avoid the dermis. It's important to maintain safe depth. Obviously, you need to assess what the safe depth is depending on the area of fat of your patient. Hence, part of your assessment earlier, the fat thickness is important. Typically, insulin syringes of 30 gauge to 32 gauge is used for facial areas, 27 to 30 gauge for body areas. Between 2 to 6 sessions are usually required to achieve the desired results. And you do one session every 4 to 8 weeks to allow enough time for breakdown, healing, and remodeling. So what is some important anatomy we have to remember? Our submental area is commonly treated, and that's our double chin area. But remember our platysma, submandibular glands, facial arteries and veins, and your marginal mandibular nerve run near that area. Incorrect depth or placement can cause asymmetry, dysphagia, necrosis, and neuropraxia. Expected results. Patients typically experience mild to moderate circumference reduction with improved contour definition, and it's normally gradual changes over weeks to months. Results are modest, patient-dependent, operator-dependent. Like we said, it's not a substitute for bariatric treatment, surgical liposuction, or weight reduction. Then again, like we said, some common adverse effects. Expected ones: swelling, bruising, tenderness, normative erythema, induration, temporary numbness, common. Less common: fibrosis, hyperpigmentation, persistent pain, seromas, and uneven contours. And then serious complications include infection, skin necrosis, vascular compromise, nerve injuries, abscesses, and scarring. So then to build onto our lipolysis injections, there's a relatively new kid on the block called Cesarelli injections. It is based on the Fenton reaction, and it was formulated by Prof. Cesarelli in Italy. It's a combination of iron, vitamin C, and a local anesthetic like lignocaine, essentially to cause the cells to kill themselves instead of directly killing the cells via the compound. So it essentially causes apoptosis, which is programmed cell death. The iron and the vitamin C react, causes reactive oxygen species to form. The free radicals trigger apoptosis in the injected cell, which causes it to off itself. And then the dead cells are cleared from the body. And yeah, that is essentially Lipolysis 101. This is part 1 of the Lipolysis lecture series. We have another one coming up right after this.